Hello, and welcome to Reimagining Love. I'm Dr. Alexandra Solomon. I have been studying relationships for over 20 years as a couples therapist, a professor, an award-winning author, and as a wife, mother, daughter, sister, and friend. Now, I'm inviting you into this space each week as I dig into some of the toughest and most fascinating relational dilemmas of our time. If you want to discover how to create vibrant and loving relationships in your own life, you have come to the right place. This is Reimagining Love. Hi there. Welcome back to Reimagining Love. This is part 2 of what to do when your partner is struggling. And our sort of like previously on Reimagining Love is that last week I contextualized this scenario when your partner is struggling. And I gave lots of validation for why it makes so much sense that you are having a hard time when your partner is having a hard time. So now you've got some insights into just exactly what it is that your partner's struggle stirs up or activates inside of you. And you've gotten your head around why it's so valuable for you to be willing to account for the you part of the equation. So with those two things in place, we're ready to move into our next step, which is what the heck to do about it. So I'm going to talk you through 5 internal strategies. So strategies that are about how you can take care of and tend to you during this difficult time. And then I'm going to talk you through 9 relational strategies that will help you and your partner together maintain or restore your relationship, even as your partner is struggling. Okay. So let's start with the 5 strategies that are about what you can do for and with yourself. And the first one I already hinted at in last week's episode, and that is tending to little you. I think often around here, one of the first interventions I want you to do is tend to little you. Remember that she or he can't provide care to a struggling partner. Talk to her, let her rest, put her in her favorite place. You know, if she was a kid who loved being on the beach, let her play on the beach so that you can approach the situation with your partner feeling fully empowered. Second one is self-compassion. It's just going to be essential for you in this kind of a dynamic. So self-compassion, as operationalized by Kristen Neff, has 3 elements. Mindfulness. So it's going to be a really important practice for you to just notice without judgment, the feelings and emotions that arise in you. Just noticing. That's all it is. Noticing and naming. There's some sadness. There's some anger. There's some numbness. Right? Just noticing the feelings that you're having. The second pillar is self-kindness, which is just simply you offering yourself what I've been offering you, which is just validation. This is hard. You didn't sign up for this. Which doesn't mean that it's unfair, because part of the risk of intimate partnership is that some shit happens that you didn't know was going to happen. So it can be unfortunate without being unfair. You know what I mean? So self-kindness around this is hard. This is hard. And then the third one is common humanity. Common humanity that says that anybody in my shoes would also find this to be difficult. But common humanity that also says other people have their share of struggles too. It's a slippery one because it's not other people have struggles too, therefore my struggle doesn't count. It's other people have struggles too that opens you to feeling connected to other people's struggles. Not so that now you're carrying the world's struggles, but just so that you You remember that you are part of a whole. It's a little bit, we just had Dr. Kristen Neff on the podcast, and I was particularly intrigued to talk to her about this pillar, because the way that she talks about this common humanity pillar is it's the antidote to self-pity. So self-pity isn't self-compassion, and self-pity, in fact, takes us out of connection with others and takes us out to our connection with all of humanity and all of the various shades of difficulty that people face. So just know that when you hold an awareness that lots of couples are dealt cards that they didn't see coming, when you hold that awareness, it actually helps you be more compassionate with yourself. So it feels like what it does is it shrinks, your own feelings about your situation, but it actually doesn't. It helps you stay in a place of self-compassion, because if you slip out of self-compassion and into self-pity, you're going to get kind of frozen and separated and shut down. When you can stay in self-compassion, though, it primes you to act. It primes you to sign up for a dance class that feels really good in your body. It primes you to ask your partner to go for a walk with you, even if you're afraid that they're going to say no. So the self-compassion practices ready you. Like they become the foundation from which you can take those self-care actions and those relationship care actions. And spoiler alert, our Kristen Neff episode will be dropping in 2 weeks, where she and I discuss all things self-compassion. So keep an eye out for that. Okay, intervention number 3, fill your own cup. It's a little bit of the Disney did us dirty idea that our partner should be filling our cup. And certainly I want your partner to be filling your cup in whatever ways they can, whenever they can. But all of our relationships suffer when we expect that the cup filling comes primarily from the other person. You, unfortunately, are getting a masterclass on the fact that you cannot wait around for your partner to fill your cup, because your partner likely has very little bandwidth to fill your cup. But that's something that you need to be working on anyways. Nonetheless, is the healthiest relationships are ones where both people also know how to fill their own cups. So for you, in this season of your relationship, when your partner is struggling, your pleasure practices are mandatory, not optional. You must be doing the things that light you up. You just have to. It protects you from all of the risks of the things we were talking about before in the research, and it protects your relationship from resentment that's going to grow if you spend your time waiting around for your partner to feel good enough to take care of you or to be there for you or to initiate with you. So how are you going to fill your own cup? You know that I love one of my most reliable routes to helping people figure out how to fill their cups is, what did you love to do when you were a kid? When you were a kid, what helped you lose all track of time? Maybe there's some things already that you have as an adult. What are the things that get you into that flow state that Mikhail Csikszentmihalyi talked about, the flow state, where you really lose track of time, you lose track of self? What are some go-tos that you have known before that you can kind of dust off and try again? Or maybe something brand new where you get to be kind of floundery and incompetent and kind of awful at it, which is great for those of us who struggle with perfectionism, or for those of us who, if part of your pain is I can't make this different for my partner, great. Go learn a new skill where you also can't do that. It's like a chosen arena where you don't have control or mastery, that I think can feel really affirming. Something I've learned from Martha Beck, who, by the way, is our guest on Reimagining Love next week, is that creativity is the antidote to anxiety. So I want you thinking about something where you are building or growing or creating, even if that's just through your body, through some kind of movement practice or exercise or dance. And then the fourth one is ring theory, which I've talked about on other episodes. Ring theory comes to us from the world of grief education and grief therapy. So imagine like concentric circles, and the person who is grieving is in the center circle. And then the closest loved ones are in the second circle, and the community is in the third circle. Like the kind of more distal people are in those other circles. And the arrows that go out are that the griever gets to vent out. You vent out to people who are less and less close to the person who had passed away, and support goes in. The distal people support the closer people, and the closer people support the grieving person. It's a really nice way of framing how, what grieving in community looks like. So you need your own little ring theory. Who can you vent? Who do you vent to, and who supports you? Who's not quite as close to this situation as you are, who can hold space, make some space to just let you vent. It's very helpful to have somebody where you can say all the nasty, petty, yucky, embarrassing, inappropriate stuff, where you can just like let it all go. And you can maybe prime them by saying, can I just riff here for a minute? Are you available for me to say all the stuff that I kind of feel a little bit shameful is bopping around in my head? And to have a person who's like, sure, bring it on. We'll just leave it right here in the, if you're down at the lake, visiting the lake, or sitting by the river, or sitting in the forest, like just give it to the trees, give it to the water, just say it, get it out of you, and move on. This is also certainly a time to have a therapist. It's a wonderful reason to approach an individual therapist and say, I need some support. I have a partner who's struggling with, X, Y, or Z. And I need to figure out how to be well, how to live well in this situation. This part is hard because part of you knows you're doing this, you're seeking these alternative sources of support because your partner can't be there for you. So I don't want you to bypass the grief that is there, that you need this additional support because your partner can't support you and because your partner's having a hard time. That's all true and that's all real. And can you trust that in creating this little village for yourself, there's learning and growth in that? If you're somebody who's never asked for help, there's some learning and growth in you asking for help. And remember that it feels good to be helpful. So letting people help you feels good to them. And it also, frankly, I'm framing this as a way of you taking care of yourself, but this is also you taking care of the relationship. Because if you have your cup filled up by a wonderful therapist, some good friends, some community, then you are able to go home feeling a little bit more neutral, a little less reactive, a little more collaborative, a little more patient. So the time you're taking to have your cup filled, to connect with people, to create a village, that investment is actually an investment in your relationship. And then finally, the fifth one is just to carry the big questions. It's very understandable that in a situation like this, you're asking questions like, what's appropriate in terms of how long to be in a situation with a partner who's struggling? Or how do I know when the hard is too hard? Like those big kind of existential questions that put you at the precipice of something kind of scary, of imagining, what if I'm not able to stay in this relationship? What if I don't want to stay in this relationship? And so my suggestion here is to know that you get to have these as questions that you carry. You get to carry questions that for right now, you don't know the answer to. It is okay to not know. It is not shameful to not know. It's courageous to carry the questions. It's a hell of a lot easier to collapse the question by either calling a divorce lawyer or by pushing the question so far underground that you can't even see it anymore, right? Those are actually the easy answers, to either act on it by ending the relationship or act on it by suppressing the question. The more courageous route is to carry the question, to know that for today, you are in this relationship, you are showing up, you are doing the best you can, and you are aware that one of the things that's in the room, maybe just in the corner of the room, is a question: how hard is too hard? How long is too long? It's okay to not know. There is not an effective, precise measuring tool. And in fact, I would worry about somebody who you encounter who's offering you the precise tool of this is how you know. It's way too big. It's way too multifaceted. Your endurance is shaped by your partner's ability to practice self-awareness and compassion, how much they can say, I see you. I see, even as I struggle, I see you trying to figure out how to be with me and be near me. I sure appreciate the shit out of that. It's shaped by your own history, your own trauma history, how activating this is for you. It's shaped by the degree to which you can effectively create community around you that helps you carry this more easily. So what I want to invite you to consider is that the presence of those questions reveals the difficulty of your situation, not the limits of your competence, not the limits of your intelligence. You don't have this figured out right now because it's hard and it's messy and it's imprecise. Not because you're too dumb to figure it out, not because you're too weak to figure it out. That's not what's happening. Be patient with yourself. Carry the questions. I just heard a story last week about somebody who was in a long-term therapy. She was married to her husband, and it was a situation that was not getting better. He was not taking responsibility. And she was saying, it's okay. It's not that bad. We can keep going. Her light bulb moment was when she told her therapist the story. And she said to the therapist, that thing that happened this week with my husband sure sounds a lot like that thing that happened with him a couple of weeks ago, doesn't it? And the therapist sat for a moment and she said, no, the thing that happened this week sounds a lot like the thing that happened 2 years ago. So this woman had lost, truly, she had lost all sense of timeline, in her suffering, in her accommodation, in her belief that this could be different if she just kept, stayed the course. She lost the timeline. She thought that this had been happening for a matter of weeks. And it was her therapist who's like, no, my dear, this has been happening for years. And that's, I think, what can happen. We're so immersed in our suffering that we lose that wider perspective. And so it may be that your clarity comes from the people around you who are also carrying your story and who can remember that at this point, here's where you were at. And at this point, here's where you're at, that can kind of carry the long-term frame for you. And that may be part of what helps you get clear on when enough is enough. But you don't have to know that right now. And your desire to be patient for right now is admirable and it's courageous. And the mere fact that you are carrying questions will build your inner capacity and resources. Okay, I want to talk a little bit about some relational practices. First one is, I want you to share your insights with your partner. If there's something that came to you during this podcast about a connection you're making from your past to this situation with your partner, talk to your partner about it. Look for opportunities to talk with them about the insights you have about how your response to their struggle is shaped by your stuff. It's not taking anything away from their pain. It's not you blaming them for having this struggle that activates your old stuff. No, it's about the fact that it's okay to want to be understood by your partner. Something I see happen a lot in situations like this is that the non-struggling partner really wants to put on a brave face and really wants to appear to their struggling partner like they're okay, that they're fine. But usually, you're not as good an actor as you think you are. Usually, there are tells. Usually your struggling partner knows that there is some wear and tear and strain on you, even if your struggling partner isn't talking about it. And by the way, your struggling partner may not be talking about it because they feel ashamed of it. They feel ashamed that their problem is affecting you. So they're kind of like, if we don't talk about it, maybe it doesn't exist. So for you to say to your partner, hey, I've got some thoughts about, how your struggle is affecting me. And I wonder if you might be interested or available to hear the connections I'm making between my own past and what's going on right now. And in doing so, you might help your partner feel a bit less ashamed about the fact that there's wear and tear. Yes, there's wear and tear because their struggle is difficult on you, but there's also wear and tear because their struggle is awakening things inside of you that started long before you met them. And that's might be really helpful for your partner to know. And the other reason I want you to talk to your partner about your struggle is that what we know to be true is when somebody's having a hard time, being helpful helps them. If your struggling partner is the patient right now and they are receiving a lot of support, they are receiving a lot of care, they're receiving a lot of attention, it might feel really good for them to actually be pulled out of that and asked to pay attention to you. Being helpful feels good when we're having a hard time. Giving your partner a chance to be helpful to you lets your partner remember, oh my God, wait, I'm more than my struggle. Yes, I'm a patient right now. Yes, I'm struggling right now, but I can still be there for my partner. I can still make my partner feel good. I can validate my partner. And that might be just a little boost for them. Okay. Number 2, I think what's difficult about this dynamic is that you can't know what your partner needs in any given moment because what your partner needs in their struggle might be different in different moments. One day they might need distraction. One day they might need problem solving. One day they might need advice. One day they might need respite, like go do something fun. One day they might need assurance, reassurance, right? One day they might just need to feel like you are their rock. But you are not in charge of knowing on any given day what it is that your partner needs. And the rightness, like getting it right, offering the right support in the right moment, that actually matters less than your partner feeling like your heart is in the right place. You can suggest something that is completely off the wall and never going to work. But if you suggest it in a way where your love comes through, I think that's what's going to land for your partner. Even if the answer that your partner gives you is, no, I can't do that. That sounds terrible. If what they have felt from you is your love and your heart being in the right place, I think that's what you get credit for. So oftentimes people wonder, like, should I just make a suggestion to my partner? Like, I think today we should head to the city and go for a walk. Or should I offer my partner options? Here are 5 things we could do today. And I think it's trial and error. I think that what matters less is you figuring out the right way to offer support. Do I offer a menu? Do I kind of offer one thing only? That matters less than you just conveying that you are available and energetic and loving and that you will take the lead. If you don't know what you want, then I'll take the lead and I'll suggest something for us. But if you think that you know what would feel good to you today, I bet I can figure out how to make that fit into my vision of my day. Okay. Number 3, I think it's important to let your partner be the ultimate authority on what they need. One of the practices that's helpful here is loving detachment. So if you do make a suggestion and it doesn't go anywhere, to lovingly detach, right? Your suggestion is not you. Your sense of self, your sense of worth is not on the line. It's not up for debate. Your sense of worth, your goodness is not contingent on whether or not your partner sees your suggestion as a good idea. So make the suggestion, let go of the outcome. That's called loving detachment. A note here, if you find that's particularly hard for you, if you find that you are particularly invested in making suggestions that land well for your partner, if you find yourself like really wanting to be like, my partner thought it'd be better to stay in bed, but then I got them to go to the art fair and then it was a great day. And then I said, see, I told you we'd have a fun time. If you're stuck in that cycle, I think it's probably time for you to go pick up Terry Cole's book called Too Much, which is about high functioning codependence, which is about how lots and lots of us, especially women, get our sense of self all entangled with our sense of helpfulness. And we burn ourselves out and we end up feeling pretty angry and resentful. Because if you want credit for the suggestions you make that go well, that means you're also going to end up getting blamed for the suggestions you make that don't go well. It's just too much. It's too much for you to be riding that roller coaster that is contingent on how successful your interventions are. So loving detachment and Terry Cole's book, Too Much. Number 4, I want you and your partner to take a team effort around resentment prevention. Resentment is a very, very real risk here. And you may have heard me say before, resentment is a symptom that lives inside of you, but it holds data for the relationship. If you are feeling resentful, that indicates that the balance, something's off in this relational ecosystem. And so I really want you and your partner to work together as team resentment prevention. And what does that mean? That means that when you say to your partner, I am going to do a girls' weekend in the city, I want your partner to say, fantastic. That sounds great. I would love for you to dip out, go have fun for a while. And that both of you know and understand that you taking the space that you need is protective of the relationship, so that you feel pride in stepping away rather than guilt, and your partner feels pride in sending you away rather than abandonment. And you're not going to get that totally right, and it's going to be imperfect, but that framing is really helpful, that when a caregiver steps away, that is a victory. That's nothing to feel bad about, because the stepping away, the recharging the battery, that is all about preventing resentment, because resentment is going to erode relational connection. Number 5, share in the grief. Be in the grief together. Talking about the sadness and fear and worry does not take away from your partner's resilience. Talking about the sadness, fear, and worry does not increase the chances of a poor outcome. Talking about the sadness and fear and worry does not mean that the two of you are negative Nellies. Talking about the sadness and fear and worry will actually open up the space to talk about the positive. And when you do, it's going to feel more authentic rather than just like Susie Sunshine, everything's fine, everything's great. No. When you talk about the positive and the hope after honoring the heaviness and the grief, it's all that much more authentic and connected. Number 6, celebrate the victories, even if they're small, especially if they're small, because when you're dealing with a challenge, in fact, nothing is small. Everything counts. Everything matters. Every little bright spot is a bright spot and deserves to be noticed and celebrated. And you can celebrate victories even as they sit next to the grief that, oh my God, can you believe that this is what we're counting as a victory? 5 years ago, this wouldn't have been a victory. Who cares? If right now it is a victory, can you also celebrate it as such? Can you hold the grief and the victory right next to each other? That's hard, but you can do it. Number 7, cultivate weeness, WENESS. This whole show has been about that, yes, this challenge is your partner's, but it belongs to the two of you. I have noticed that especially if it's a straight couple and the man is the one with the challenge, the thing he wants to do is kind of hide out in his room with the challenge, get the challenge figured out, and then step back out of the room when he's all better. It's really hard and quite unnatural for a man to let himself be seen as he's struggling. But the reality is that when couples can be a we are here healing your depression, which doesn't mean that you are responsible for your partner's depression, but you are part of the treatment plan. When you can approach it that way, it helps your partner say thank you to you for your support rather than I'm sorry. And that makes a world of difference because I'm sorry is very much like your partner has shame and believes themselves to be a burden and believes themselves to be too much, where the thank you is, I see you. I can hold myself in positive enough regard that I can see you, my partner, you know? And so approaching it as a we're in this together. And your own work, the work that we were talking about a bit ago, will help you feel like you can be part of a we. And your partner's work, believing that they are more than their diagnosis or they are more than their challenge, and that actually the hiding makes it worse, that will hopefully help your partner see that the two of you are a we. Number 8, strategies for rebuilding after a period of struggle. I'm thinking about these scenarios where there was, let's say, a 6-month course of treatment, and now you're kind of coming out of that dark night. And you can see the sun peeping up on the horizon, and your partner's getting healthier, or things are kind of clearing, or the really messy legal challenges behind you. When you start to feel like the challenge is behind you, the urge might be to go real fast and be like, okay, let's get back to normal and let's do this and let's do this and let's talk about how hard that was. My suggestion to you is that you go slow. Go slow, step by step. Test the waters. You don't want to activate shame or defensiveness. Go slow also because it might take a little while for you to be able to trust that your partner actually can handle more than they did. So you might need to go slow. Your partner might need to go slow because they're just getting used to being more present, having expectations placed upon them again. And you might need to go slow because you might be so used to taking care of everything now that there might be some challenge for you in the surrender. It might take a little while for you to trust. So just little bits at a time. This is what I have learned so much from the trauma therapist, is that we go slow to go fast. It's going to be more effective if you can just take it step by step, even if one or both of you wants to slam the door behind you and be like, okay, that's over, back to normal. The faster you go, the more you're going to get kind of resistance or pushback inside of one or both of you. And then finally, number 9, I want you to come back again and again to this question. How can we protect all of what is good about our relationship from the impact of this struggle? How can we protect all of what is good about our relationship from the impact of this struggle? I just love that question because it positions the two of you shoulder to shoulder, putting the struggle in front of you. How do the two of us stay connected even with the challenge of your depression diagnosis? How do the two of us protect all of what's good about our relationship even as you're doing this really hard thing, which is looking for a new job? The process of wrestling with this question helps the two of you reclaim agency and authority over your love story. So think about, what can the two of you still enjoy, even if it's only sometimes? What are the realms of your relationship that are in fact not affected by this struggle, right? It can feel like the struggle seeps into every bit and corner of your relational life, but keep an eye out. Where are the pockets where the two of you feel like the old version of the two of you, and pour into those. See if you can make a little more time to have those kinds of experiences together. I like the idea of the two of you guys scheduling couple meetings. Sometimes when there's a struggle, the non-affected partner wants more information. They're like, I want to hear how the doctor's appointment went, or I want to hear what the meeting with the lawyer. I want to hear how you're feeling. I want to hear if you sent any resumes today. The non-affected partner wants more info. And so to kind of cut against that cycle, that kind of pursuer, distancer cycle, make a weekly couple meeting. Then you will know, okay, I can hold my questions because I know on Thursday at 7, I'm going to get to ask my 5 questions about what's been going on. And sometimes you need a couple meeting because you need to contain the conversation about the struggle, right? It feels like every conversation on every walk at every dinner ends up being about the struggle. And then that feels like it's overwhelming to you as the non-affected partner. Well, then you might need a couple meeting to say, listen, can we just contain conversation about this problem to a Tuesday and a Thursday window of time? And that way your partner can maybe soothe themselves, knowing that they will get to talk about it at some times. And you get to feel safe knowing that you can be with your partner without this being front and center. So there might be a couple of different scenarios why you need a couple meeting, but I really like helping couples bracket those conversations. And then finally, couple therapy. Of course, I'm going to recommend that. It's a very legit thing to go to a couple therapist and say, here's what we're struggling with. Can you help us? And to just make that space together. All right, we did it. We talked all about self-care for you so that you can stay well in a hard situation. And then we talked about relational care, what the two of you can do together to protect your relationship from the impact of the hard situation, and hopefully to grow your relationship. I mean, you're not ever going to be like, oh my God, we're so glad this thing happened. You're never going to get to that point. You don't have to get to that point. But where you can say, yeah, we didn't ask for this shit, but this shit is growing us. And I feel like I understand myself better. I understand my partner better. And I can see the ways in which this has really made us stronger as a couple and as a team. So that is my hope for you and my wish for you. I'm very eager for your questions and your comments and appreciate getting to spend this time with you. And a reminder, next week, we have the amazing Martha Beck on. And then the week after that, we have Kristen Neff. Oh, so many good things to come. So I will see you right back here next week because I can't wait for you to hear from both of them. Okay, my dear, until next time, be well. Do you have a relationship question that you want answered on the show? Visit reimagininglove.com to send in a written or audio question. Questions can be about intimate partnerships, family relationships, friendships, you name it. If you're looking for more love and relationship content, you can find me on Instagram at dr.alexandra.solomon or visit my website, dralexandrasolomon.com, where you'll find my blog as well as the Intimate Relationships 101 e-course based off of the popular class I teach at Northwestern University. Thank you for listening and see you next week here on Reimagining Love.